Hi everyone. So in our previous lectures, we have already covered up to keratinized mucosa, and today I'll be talking about non-keratinized mucosa. So we know that the non-keratinized mucosa, it is divided into lining mucosa and specialized mucosa. So the questions are mainly framed from the specialized mucosa, and I'll be covering lining mucosa though, just for the sake of completion, as much as it's given in the textbook. But it is not very important. But the questions are rarely asked from this topic, so keep that in mind and mainly focus on the specialized mucosa. So I'll start up with the lining mucosa. Basically, everything else we have studied, okay? So everything other than the gingiva, hard palate, vermilion border of lip, and the specialized mucosa, everything other than this is the lining mucosa. So the lining mucosa, it is present in the vestibular fornix and alveolar mucosa. So these are the portion above your mucogingival junction or the mucosa. Okay. So the portion above this connecting your lip to kind of your gums. This is the vestibular fornix and the alveolar mucosa. Then it is present in the inferior surface of tongue and floor of oral cavity. Okay, so the lower surface of tongue and the portion which makes the floor, so the portion below your tongue, that is the and that is also lining mucosa, covered by lining mucosa. Okay, then there's soft palate and lip and cheek mucosa. So this is everywhere lining mucosa is present. So the only one that is given in slight detail in the textbook is the lip and cheek mucosa. So I'll be covering it. So the lip and cheek mucosa, and the epithelium, it is stratified squamous non-keratinized. Okay, so this is the type of epithelium present. Then the lamina propria, dense connective tissue, short irregular papillae. So dense connective tissue, okay, that's fine. But the main point to remember is that it has short papillae. Okay, the papillae aren't very long. We saw long papillae in the masticatory mucosa, but here they are short. Okay. The submucosa. The submucosa connects the lamina propria to the thin fascia of the muscles. So underneath this submucosa, there is muscle present. Okay. So which muscle is present? So this could be either buccinator in cheeks. So in case of cheeks, this would be buccinator, and in case of lips, this would be orbicularis oris. Okay, so this is the muscle present underneath the submucosa, right? So what does the submucosa do? This is the submucosa. It connects your lamina propria to the muscle underneath. Now it contains densely grouped collagen fibers, which limits its mobility. So we see these collagen fibers. These are present in the submucosa. And what's the function? They do not let this mucosa move. Okay. And why is that important? This is important because when we're eating, we don't want our lips and cheek to come in between your teeth. So it limits the mobility of the mucosa, which prevents the mucous membrane from lodging in between the teeth during mastication. Okay. In between the strands, there is loose connective tissue. So this is loose connective tissue containing fats and mixed glands. Okay. So there is some fats and mixed glands present. Mixed glands are present in the lips only. Okay. So this is the structure of the submucosa, right? In lips, mixed salivary glands are present in the submucosa, okay, whereas in the cheeks, the glands are larger and are found in between bundles of buccinator muscle or on its outer surface. So in lips, we find these glands. You see these glands in here. But if this was a cheek, if this was a diagram of the cheek, you would find these glands somewhere over here, okay, or in between two band of the muscles, two muscle bands, okay. So this is what that sentence is saying, right? Now then we have something called the Fordyce spots. And what are these? These are isolated sebaceous glands, okay, situated in the cheek, lateral to the corner of mouth, opposite molars. So these are basically just sebaceous glands, and this is mentioned in the textbook, so it could be important, right? So these are the Fordyce spots. Okay. So this is it about lip and cheek mucosa and lining mucosa. Now moving ahead with the main topic, that is the specialized mucosa. So specialized mucosa includes the dorsal lingual mucosa, dorsal lingual mucosa, which is the dorsum of the tongue. Right. So the upper portion of the tongue, this is specialized mucosa. The inferior portion, the portion like underneath this, that was lining mucosa. That was covered by lining mucosa. Okay. So starting with this, and the superior surface of the tongue is rough and irregular. So we all know that. We've all seen that. Okay. It is divided into anterior part and the posterior part. So the anterior part, this is the anterior 2/3 part, okay, and this is the posterior 1/3 part. Now this is divided using a line, a V-shaped line. This line is called uh, sulcus terminalis. Okay, so terminal sulcus. This is the line dividing the tongue into anterior and posterior parts. Okay, the anterior part is supplied by lingual branch of trigeminal nerve, whereas the posterior part is supplied by the glossopharyngeal nerve. So if I have to draw it over here, on the anterior part, this has a different nerve supply, and the posterior part has a different nerve supply. So what is the nerve supply? The posterior part has a nerve supply of glossopharyngeal nerve, and the anterior part has blood supply of lingual nerve, and lingual nerve is a branch of trigeminal nerve. Okay, and why do they have different nerve supplies? So that both the parts, they are made up of, they come from, or they originate from different arches. Okay, so we all know that in embryology, when we have a fetus, when we have a developing embryo, it is divided into various arches. Okay, and then each arch forms something else. So these two parts, they are formed from different arches. Okay, that's why they have different nerve supplies. Okay, so they arise from different arches. And then the foramen cecum is the remnant of thyroglossal duct. So remember, we have a structure over here, okay, on the sulcus terminalis, and that is called the foramen cecum. It must be highlighted over here. Okay, it's not mentioned. I'll just write it down. There's a structure over here. This is called foramen cecum. Foramen cecum. Okay, and that is the remnant of the thyroglossal duct. Okay, so but there are other structures as well. So this is the epiglottis, this portion. This is the epiglottis. Okay, this is the palatopharyngeal arch. Not very important, even if you don't remember it, it's fine. Then we have palatine tonsils. Okay, remember this is like everything that is contained in the posterior part. The posterior part extends from here to here. Okay, then the main part, the posterior part contains a lot of lingual tonsils. Okay, so the posterior part, we saw that behind the terminal sulcus, we have the posterior part. This first it has lingual tonsils, then it has this arch. Okay, then we have palatine tonsil, and it ends with the epiglottis. Right, this is the structure of the posterior part. Now coming to the anterior part, okay, so we have this terminal sulcus, we had foramen cecum, we saw that. Now the anterior part has papillae, and there are four types of papillae. First, we see these huge papillae. Okay, these ones are called circumvallate papillae. They are present just near this sulcus terminalis. Okay, then we have foliate papillae. So you see these arches towards the end on the lateral surface. These so there are some papillae that are in between these arches, and those are called foliate papillae. Okay. Then we have this median sulcus of the tongue. Okay. And then on the entire surface of the tongue, these rough surfaces and these rough structures. Okay. This is contained of, this is made up of fungiform and filiform papillae. Okay. There are four types of papillae. We know we have valid, circumvalid papillae, foliate papillae, fungiform papillae, and filiform papillae. Okay, so these are all the structures, and then the nerve supply, we already saw that. Okay. Now moving ahead, um, this was the basic structure. Why is it going down? Just a second. Right. So moving ahead, Now I'll be talking in detail about the anterior part. Okay, so the anterior part, it is also known as the papillary part. Okay, it contains tiny projections called the papillae. So what are papillae? Papillae are epithelial projections containing core of connective tissue. This is the definition of papillae. What this basically means is, so they are just projections of the epithelia. Okay, projections means like something that is kind of coming out. Okay, and then the core of this papillae, it is made up of connective tissue. This is all the definition means, right? Moving ahead, the covering epithelium, it is keratinized. So this epithelium of the papillae, it is keratinized in nature. Now the types of papillae. So we know that there are four types of papillae. We already saw that. We'll discuss it in details. First, we have filiform papillae. Okay, so the filiform papillae, they do not contain taste buds. Okay, these are the only papillae that do not contain any taste buds. Okay, then the other papillae, right, I'll just highlight. And then we have fungiform papillae. So the fungiform papillae, they are mushroom shaped. They are reddish in color, and because they are reddish because their epithelium, this epithelium is very thin. Okay, so they appear reddish because the capillaries are visible, so they appear reddish. Okay, so they're mushroom shaped. They're reddish in color, and they contain 1 to 3 taste buds. So if you see over here, this is the fungiform papilla. So it is like roundish in shape. Okay, and it contains these taste buds. If you kind of zoom in, you will see this labeled as taste buds, and it has like 3 taste buds. Okay, and if you look at this one, is the filiform papilla, so it has no taste buds, and it is kind of like cone-like in shape. Okay, now coming to the valate or the circumvallate papillae, these are found in front of the V-shaped sulcus, the sulcus terminalis. Okay, now they are 8 to 10 in number. So we saw over here, these ones, they are total 8 to 10 in numbers in number. Okay, they do not protrude above the surface of the tongue and is bounded by deep circular furrow. So if you see all the other papillae, they are coming out of the surface of the tongue. Okay, but this is the circumvallate papillae. This is the surface of the tongue. Okay, but this is contained within the surface of the tongue. Okay, so this is one of the features. Okay, it is bounded by deep circular furrow. So this is the furrow that binds the papillae. They contain numerous secondary papillae. Okay, so there are like numerous papillae coming out of this one. Okay, and taste buds. So there are many taste buds present. Ducts of small serous glands called Ebner's glands open into the throat, which are the main source of salivary lipase. So basically, what this means is, so there is some glands, okay, and their ducts open into this, the throat of this papillae. Okay, so over here. So these ducts will open in here somewhere, and these are the ducts of glands called Ebner's glands. Okay, and these glands, these are the major source of salivary lipase. Okay, just use a different color. So Ebner's glands, and these are the main source of salivary lipase. Now the last one we have to discuss. This is the foliate papillae. Okay, they are found on the lateral border of the tongue. So we discussed that foliate papillae are present like over here. Okay, they are found on the lateral border of the tongue in the large papillae clefts, and they contain taste buds. So there's nothing special, nothing new. These are found in the clefts of the tongue on the lateral border, and they have taste buds. Right. So this was all about the anterior part. So we have covered this portion. Now we will be talking about the posterior part, this portion. Okay. So um, if you look, and I'll just go back to the diagram. If you look at the posterior part, right, I'll remove this. The main feature that is present in the tongue, it is the lingual tonsil. Okay, so these projections, these huge, big projections, this is the lingual tonsil. So in the posterior part, the lingual follicles form the lingual tonsils. So these structures, those lingual tonsils, they are made up of the lingual follicles. And what are lingual follicles? These are round prominences containing lymph nodules and a germinal center. So lingual follicles, these are the structures which make up the lingual tonsil, and they look something like this. Okay, so they are prominences. They contain these lymph tissue. Okay, they contain these lymph nodules, and they have this big cleft in between. Okay, so this is the lingual follicle. Now, lingual crypts. So this cleft in between, this is the lingual crypt, the small pits present in the lingual follicle. This is lined by stratified squamous epithelium. Okay, so this epithelium, it is the stratified squamous epithelium, and ducts of various lingual mucous glands, they open into these crypts. So the various ducts, they will be opening into these crypts. So this is basically what the lingual tonsil is made up of and the structure. Okay, this is not very much important. The main part was the anterior part. Okay. Now coming to another important topic, that is the taste buds. So we know that these filiform papillae and not the filiform papillae but the fungiform papillae, foliate papillae and circumvallate papillae, they contain taste buds. Okay, so we have to discuss the structure of these taste buds as well. So what are taste buds? And this is a definition. These are small, ovoid or parallel shaped intraepithelial organs. Intraepithelial means within the epithelium. Okay. These are about 80 micrometers high and 40 micrometers thick. Okay. They extend from the basal lamina to the surface of the epithelium. So this is the definition of a taste bud. Okay. Uh, sorry, this shouldn't be parallel shaped. This doesn't make any sense. This should be barrel shaped. Okay, just correct it. Barrel shaped. B-A. Okay, so these are barrel shaped. What does a barrel mean? Barrel means basically kind of like a structure like this. Okay, so this is not exactly correct. This is a barrel. Okay, so these are barrel shaped structures. Okay, barrel shaped intraepithelial organs. Right? So this is the structure of the taste bud. Now, this going in detail, this is the definition. Now going in detail, structure. So the structure, the outer surface is covered by a few flat epithelial cells surrounding a small opening called a taste bud. So if you look over here, this is the outer surface, okay? This is covered by some epithelial cells, okay? So there are like some flat epithelial cells present over here, up to here over here. Okay, so these are the fat epithelial cells, and this is the taste pore. Okay, so taste pore is basically just a pore. Okay, and this taste pore leads you into a space where we have these supporting cells. Okay, so over here it says receptor cells, but remember there are three types of cells present within the taste buds. So first we have some outer supporting cells. Okay, then we have some inner supporting cells. And then in between the inner supporting cells, so if I have like two inner supporting cells, I will have these taste receptor cells. Okay. So there are three types of cells that are present within the taste buds. So the outer surface, we had these epithelial cells and taste pore, right? The taste pore leads to a space which is lined by the outer supporting cells and the inner supporting cells. So we have these two types of cells, and the inner supporting cells are short and spindle shaped. They contain 10 to 12 neuroepithelial cells in between them. Okay, so these are the neuroepithelial cells. These neuroepithelial cells are the receptor of taste stimuli. So these yellow colored neuroepithelial cells, these are the ones which will detect taste. Okay, so these are receptors of taste stimuli. And then we have this nervous network present beneath the taste bud. All right. So this is it about the structure of the taste bud. Now going to the very last topic of this lecture, that is taste sensation. So there is this classic theory we have all studied in childhood, that we detect like sweet taste on the tip of our tongue, sour on the lateral side, okay, on in the posterior lateral side, Then we have bitter taste and detecting ability on the posterior side and salty on the anterior lateral side. Okay, so this is the classic taste theory. Now, how this correlates with our taste with our papillae is that the theory suggests that we detect bitter taste through valate papillae, okay, sour through foliate papillae, and sweet and salty through fungiform papillae. Okay, so this is what the theory says. It is not entirely accurate, but we also know that the valate and the foliate papillae, they are supplied by glossopharyngeal nerve. Okay, this is the posterior part, and then the fungiform papillae, which detect sweet and salty taste, they are supplied by intermedial facial nerve, or you can just write chorda tympani. Okay, so you don't have to go into that much detail. Just write chorda tympani, right? So this is supplied by the chorda tympani. This is all about the taste sensation. We have, if it comes up in the exam, just draw this diagram, okay, and talk about the papillae and its nerve supply. That's all that's present in the textbook. If you like the lecture, if they are helping, then please like, share, and subscribe. Okay, thank you.